bystanders and how it tends to be a relatively promiscuous molecule that has a lot of non-specific binding. Okay? Not something that you could do this entirely with text, but a visual might help emphasize this. Especially if later on I'm talking about low molecular weight heparin, which has much more specific binding affinities, and I can show you I can repeat another part of this using low molecular weight heparin and showing that all of it binds to antithrombin with very little binding to other molecules. So you're emphasizing the difference between two molecules, this time using a picture rather than just talking about it. And as I said, you can add humor. People like jokes during their talks. A lot of people are, I would say most people in our profession are not comfortable getting up here and doing stand-up, okay? So because I don't do stand-up, anytime I want to put a joke, I somehow embed it into a slide because depression is not funny, okay? So, unless it is. What's this guy okay. Finally, speaking tips. Some general speaking tips here. Before you present, this is what you do when you practice. You practice itself, and hopefully in front of an actual live audience, rather than just blah, blah, blah into an empty room, which is fine. Ideally, have someone listen to you and feel comfortable giving you hard criticism, like, I got totally lost on this slide. This part doesn't make any sense, or this part was awkward, this part you went by too fast, this part got too slow. It's practice, solicit feedback from your talk. You don't want to memorize your talk, but the opening and closing lines of your talk, if you're going to memorize anything, that might be something to memorize. It's kind of like flying an airplane. Takeoffs and landings are often difficult. Once you're in the air, though, and flying straight, it's pretty smooth sailing. So it may be useful for you to memorize how you're going to get things started, memorize how you're going to finish things off, but not to memorize the entire talk. As you're getting ready to give your talk, be sure to empty your bladder, but have fluids available, because after talking 45 minutes, your mouth does get dry. And if you're nervous to begin with and you have a full bladder, that's going to be a bigger problem. Be sure you have some way of keeping track of time. There's a nice clock in the back of the room, so I know I'm doing fine here. There are some people who, for whatever reason, essential tremor, whatever it is, stage fright, whatever you want to call it, performance anxiety is so bad that it just sabotages their talk. There is nothing shameful about using some pharmacological aid, like a beta blocker, if you're that person. And most people aren't, but there are people who they handshake their voice. It takes a Katharine Hepburn-esque tremor, and a beta blocker can do wonders in that situation. Be sure to take a test dose beforehand so you don't syncopise and tremor. And finally, I crossed out, during the actual presentation, and I crossed the word talk and added the word show, because keep in mind, and I think people who do a lot of talks, who will get really good reviews on their talks, if you ask them, are you there to educate, or are you there to entertain? And a lot of them will say, well, a little bit of both, but I'm definitely there to, if I educate them, great, but what I really want to do is entertain them. And in fact, in many contexts, when you're giving a talk, your educational value is there, yes. But the entertainment value, in some ways, is more important to your overall evaluation. You can say people are shallow and whatever, but that's the reality. So you're there to entertain the audience as well as to educate them. So a couple of general pieces of advice there. Don't stand behind the podium. Okay. Almost every place you're going to give a talk, they will provide you with a very nice podium that usually stands about 4 feet high or so, 4.5 feet high. If you're a tall guy, and okay, if you want to use the podium and stand well above it, great. If you're a woman and you're, that's not particularly tall, 5'4", it's like this, you're not seeing a whole lot of me at this point here. And you're going to be a lot more impressive if you're standing away from the podium, where you can see the entire person. People can see you gesture. People can see you be animated and excited, rather than having this big shield between you and the audience. I say this over and over. Everyone still uses the podium. I can never get people not to use the podium. People who go to give talks at CME courses who get the best reviews, a lot of them will walk around and not use the podium. Makes you feel a little bit like you're doing an infomercial or something like that. Engage the audience, smile, make eye contact, gesture. there's usually some people in the audience who are really excited about the talk and look at that person to get energized. There's usually someone in the audience who, even if they may be interested, are kind of, don't look at that person. That person will suck you out your will to live and just drain the energy out of the talk. You can't be too energetic. And I say this, I was thinking about this the other day because going back to the idea of entertaining, giving a talk, the advice that people used to give is don't just relax. Okay? Just be casual and relax. Don't get too don't worry about it. Relax. And when they relax, they start having a nice conversational tone with you. I'm talking to you, and we're like sitting in front of us. You're sitting at a coffee table or something like that, and we're just chatting, and we're having a good talk. That's not what you want. You don't want naturalistic speech here. You want to overact. In other words, the way I put it is, this is, when you're giving a talk, think Broadway, not Hollywood. In other words, when you're watching a movie, you want the actors to be very naturalistic. Like, wow, he's a great actor. That's exactly, he's so realistic because he's talking so much like a real person would talk in that situation. And you've got a camera zoomed in on his face so you can see his all the tears coming down because he's a cat died. Anyway, that's not what you want, because you are far away from the audience. You are, in fact, more like a Shakespearean or a Broadway actor who has to overact. Everything should be bigger. Your gestures should be bigger. Your voice and your cadence should be more exaggerated. And you'll see this. The really good talks, if you go to a CME course or you see lectures, they are overly animated. I do not talk like this in real life, believe it or not. So anyway, don't be ashamed to overact. And finally, obviously, avoid fidgeting, pacing too much. We all have a tendency to use these nonsense, empty phrases, well, so, I'm as guilty of this as anyone else. You don't know when you're doing it unless someone actually points it out. So again, one of the reasons to get an audience or solicit feedback is to find out how often you do that, and you can give yourself a reminder. You can put a little sign here that says, don't say and that actually can help a bit. So let's conclude here with my own learning points, and I'll give you a little bit after this just to help you with what you're going to be talking about for this fellowship here. How to give a great medical talk. First of all, as I mentioned earlier, know your audience. Know who they are, and pick relevant content and appropriate learning points for your individual audience. Guide the audience through your talk by creating an organizational roadmap, and then keep things as simple as possible. Avoid information overload, especially when it comes to presenting data. Make sure your slides are functional, meaning readable, but creative, and act confident. Have fun with this, because you are the expert on your topic. No one knows more about what you're talking about than anyone in the room besides you. So you're the expert. They come to hear what you have to say. So be confident, have fun with it. A couple other quick things here. For your short talk, remind me if correct me if I'm wrong, you're giving about a 15, 20-minute presentations, is that right? Okay, so this is shorter than the average medical talk. These 15, 20-minute talks when you're doing basically your research abstracts, essentially. A couple considerations here. You can probably omit the outline slide. You're following a fairly standard format, and everyone in the audience is probably familiar with that format enough that you don't need to create an outline slide unless you're doing something very unusual for your presentation. You do need to have enough background information to frame your question for the audience. Why is my research topic important? Why did I pick this topic? Why is it important? Why should you be listening to me doing this? You need to give enough background information to emphasize the relevance of your research and the context in which you're doing it. Consider stating your research question explicitly. To say up front, here's what I wanted to know and the questions I wanted to answer. Okay, rather than trying to have people try to guess what your goals were. And again, summarize briefly with your key conclusions here. It's not all the little minutiae is not important. What are the important things for your audience to remember at the end of your talk? The same idea of using learning points. Okay. So here's my checklist at the end. If you follow this checklist, then you're in pretty good shape here. And you say, well, is this true? I will present appropriate, explicit learning points to my audience. Do I have appropriate learning points to my audience? Do I have explicit ones that I want them to get away with? Yes or no? Is my talk easy to follow? Is every word on every slide easily readable? And you can say, well, yeah, I use 24 or 32 point font. Yeah, my slide's great. Except for that, those 2 slides where I copied something out of a web page and there's, tiny little print that no one can read. If you have done that, then no, not every word and not every slide is readable. Every word, every slide should be readable. Similarly, every number on every slide will be discussed. If I'm showing a number and I'm not going to talk about that number, then there's no point putting that number up there. It's just there to distract them from your message. Okay? I made some effort to be creative, fun, varied. Okay? You don't have to, some people want to be really go crazy with their slides or in their talk. Other people are going to be a little bit more subdued, and that's fine. There are great speakers who do both things here. But I think, make an effort to be at least a little bit creative and fun with your talk. And finally, I have in fact practiced my talk out loud so that I know where the problem points are, what points work well, how to say certain things in a way that's more understandable to my audience. So thank you very much for your attention. Happy to take questions and stay around later if you need anything. Thank you.
Quinny, thanks for a wonderful talk. One other thing I would add to Quinny's list of points, and this is maybe just my own pet peeve, is to edit the slides. Because bad grammar, bad spelling, bad capitalization leave, I think, a negative impression. What they say is, you were talking about how I was too lazy to make a new slide. With the tables, this to me says I'm too lazy to read my own slides over carefully to make sure that everything is correct. So please edit. Americans in general have a problem with capitalization. I'm not sure why, what they taught y'all in school, but make sure that the caps are correct and that the grammar is correct as well. I don't know if you have any comments.
Yeah, I think so. I mean, a lot, philosophically thinking about it on a bigger scale, your slides, at the very least, you don't want your slides to hurt you. Okay, and bad, typos and grammar errors, whatever, that hurts your presentation. A slide with too much data on it hurts your presentation. Something that's unreadable actually hurts your presentation. At the very least, make sure your slides don't, annoy the audience and hurt you. And if you want to go the extra step and get fancy and make really exciting slides, then yeah, the slides can actually augment and help you. But but not everyone's going to go through that effort. Not every talk is worth that effort. But at least make sure they don't hurt you. Other questions or comments? People, experience? Yeah, please.
Sometimes when I have a slide that doesn't have very much text on it, I'll put like a random picture of I'm doing peds, so I'll put like a random picture of a baby or something. Is that bad? Is that unprofessional?
No, I think it's not wrong to do that. I think ideally, if you're going to put a picture up there, if you're going, you're pediatrics, if you're going to bother to put a picture up there, you might as well have it relate in some way with what you're saying. Mm-hmm. Okay. And unless if it's just a baby and you're doing peds, well, I don't know if that's enough of a connection. But if you're talking about a certain condition, you're talking about something. If you could swing it, then the picture actually, again, augments your talk. If it's just a picture, they're just I don't know if it really helps your talk in that situation. Anything else? All right, thank you very much.